Right, today I'm going to give you some exercises for SPD or symphysis pubis dysfunction in pregnancy. So before we start, it's important to understand that not every case is exactly the same as each other, so it's important to seek some professional advice. However, some of these exercises could give you just that little bit of immediate relief while you're seeking that appropriate help. If you do try any of the exercises and any of them hurt, or you don't feel comfortable, or they feel wrong, or like you're doing them wrong, definitely stop them and seek further help as well. That's super important. As I said, not every case is exactly the same, and there's not a one size fits all remedy for SPD, unfortunately. My biggest tip that I give to clients is one of these wobble discs. So you can get these quite cheaply, either from a sports store or on Amazon. I think I paid about 9 or 10 quid for this one. And they're great because they're small and mobile and you can carry them around with you. So they're quite easy to cart into work or in the car, or if you go around to someone's house for dinner, wherever you're going, they're very transportable. The reason I like these is because they're similar to a birth ball. So when you'll be suggested to sit on a birth ball and they're not quite as portable, this is your second best option. So you just pop that in there on your seat, and by sitting on that, it just allows your pelvis to have these really gentle movements. At the same time, it's toning the pelvis, so we're not inclined to sort of slump into our back and put more pressure onto that pubic region either. My next tip is my trusty spiky ball. So quite often with women with pubic symphysis pain during pregnancy, I find they have quite tight glutes and quite tight inner thigh muscles. And this is just because as the pelvis is moving and separating and our hormones are changing the laxity of our ligaments, the muscles are going to start to try and take over and do a lot of that supporting of that pelvis. So we get an imbalance in tightness in them, and then we get these odd pulls on the pelvis. So my two areas which I would suggest trying to release a little bit of first is glutes. So just bring your ball over to a wall is the safest way to do that. Pop it against the wall and your buttock muscle, and just roll from side to side like this, or up and down very gently, putting as much or as little pressure as you like, always remembering that in pregnancy less is more, okay? With the adductors, there's a few options. You can either sit in the chair and just gently rest that knee out to the side. You can either roll the ball up and down, or I quite like going up against a wall again. More easily done if there is a doorway there. So you can imagine if you've got a doorway up against that and you're pressing that in, and then you can just sort of roll forward and back in that doorway as well. So that's just a couple of loosening off exercises. And then a nice way to try and stabilize that pelvis is if you keep always with SPD as well, the most important thing is to always try and keep your feet within the boundaries of your hips. So don't let your legs come wider than your hips, and that's with any exercise. So a nice way, first of all, actually, if we stand up, is just to open up through there. We're still standing, we're not doing huge circles, just little ones, just to mobilize through our hips here as well. And again, keeping both feet grounded, so never standing on one leg when you've got really bad SPD pain. So you can just do a few circles out on one leg and then a few circles out on the other leg. Again, keeping them nice and small. If you experience any pain during any of these exercises, then stop. And once you've just loosened up through those hips a little bit, we'll come back down to our seated position. Bring your feet so that they're hip distance apart. Pop your hands on either side of your knees and just very gently pushing out with your knees into your hands while you're pushing your hands in towards your knees. So you're keeping the legs in the same position, but we just have a little bit of counter force between the knees and the hands. Holding that for about 5 seconds. Then bringing the hands onto the inside of the thighs, and as you draw those knees in towards each other, you're pushing out with those hands. Keeping your chest up nice and tall, spine nice and long. And then after about 5 seconds, again switching. And again, you'll just keep moving from the outer thighs to the inner thighs for about the count of 5. And repeat that maybe 5 or 6 times. And then the inner thighs again. Good. A nice thing about this one too is that when you're working those inner thighs, when you're gently drawing them in, you should feel a gentle activation through the lower abdominals. So the adductor muscles, or the inner thigh muscles, co-contract with our obliques, and it's nice to have a low level activation through pregnancy. So as you are drawing your knees in towards each other, just imagine that you're giving your baby a gentle hug and just lifting up through that pelvic floor as well, so we're not getting any bearing down on that pelvic floor. So that's just a couple of little exercises, nice little ones just for that relief. If you're anything like me, I suffered it a lot in the middle of the night when I'd get up for my midnight toilet stops, and I'd find I would get out of bed, and especially when the muscles aren't woken up and they've been a little bit sleepy, I would get that sense, that feeling like I couldn't stand on my leg and my pelvis was just going to collapse. So these are nice little go-tos when you're in those sorts of situations. And as I said, it's important to seek professional advice as well if you are getting really bad symptoms, and remembering to get onto it sooner rather than later. You don't need to be suffering this pain, and there's lots of things and lots more suggestions, a trillion out there depending on your case. So definitely seek help and try and enjoy the pregnancy and be as much as comfortable as you can during that time. Okay,